Here's step by step how to heal your hip arthritis. The treatment approach that I use to heal hip arthritis naturally so that you can avoid having a hip replacement surgery is broken down into 4 phases, and I've got them all right here. This is straight out of our Hip Arthritis Recovery Program, which you can learn more about. You can get more details on it in the description below. But this is printable from the program. There's 4 phases. The first phase is getting your hip pain under control, getting the inflammation down. And what's entailed in this phase, if you can't be on your feet more than 10 minutes, you have pain at night, that's 4 or more days per week, or if you have pain at rest 4 or more days per week, or if you have stiffness in the morning that's more than 30 minutes, then you fall into this phase and you need to be doing certain treatments from this phase. And the treatments, just to summarize them, are more so about just calming everything down. It's doing stuff like massage, making sure that you do some very easy exercises that don't aggravate anything. The main idea at this point in treatment is just to make sure that you're not doing anything to become more irritated. You don't want to do any exercises that make the hip pain worse. This is the mistake that people make, is they might hear somewhere on the internet or even be guided by a healthcare professional to do a certain exercise that's supposed to help with hip arthritis, but it's the wrong time to do it. That exercise might very well be good, but not while you're very irritated and in phase 1 of this treatment approach that I have. So you need to be doing things to calm it down, because once you can calm it down, then you can begin to tolerate some exercise without becoming flared up. And at that point, that's where you get into phase 2. That's where you start to get mobility and the ability to do more. And here you can be on your feet a little bit longer, 10 to 30 minutes. Then you have less pain. It's still kind of frequent though, 3 or more days per week. It's still a weekly problem, but it's not consuming most of your week anymore. And then you might have pain at night or stiffness that lasts 15 to 30 minutes when you first get up in the morning, or if you've been sitting for a long time and then you get up and you feel that stiffness. Now here in this phase, it's critical that you begin to activate certain muscles that have probably been dormant. They haven't been working very good for you, and that's what sets you up to have this hip arthritis problem. Now at the core of my treatment approach, we're fixing a muscle imbalance. And in this muscle imbalance, we have muscles in the back of the hip, the glutes, the butt muscles, that are very weak most of the time, pretty much all the time. And then muscles on the front of the hip, they dominate, they compensate for the weakness in the back, and it causes the hip joint to move inappropriately, and then it puts bad pressures in the joint, and that's what sets up the arthritis. So we have to fix the glutes. We have to get them to just turn on. And this is a huge mistake at this point, is a lot of people go do exercises. They'll go do gym exercises, physical therapy exercises, stretches, all kinds of things. And rarely ever throughout the exercise process do they actually get a good glute activation. I mean, to where you feel your glutes working and then getting tired on top of that. That is a critical piece that's missing in most treatment plans, natural treatment plans, to heal hip arthritis. And when you do that, when you fix the glutes, when they start to work right, now you have a shot, you have a chance at beginning to align the ball and socket joint better to reduce the bad pressures in the hip joint that are leading to your hip arthritis problem. This is why I tell people, even stop walking. Don't walk. Because if you're walking in a compensated state, your hip flexors are doing most of the work, your thigh muscles are working a lot, then you're irritating the joint. But if you can begin to walk with the glutes working right, which is a process to figure out, then you can begin to have walking help your hip situation instead of hurt it. So this is fundamental. It is so important to be able to do right in phase 2. Now in phase 3, then we're really making strides on fixing the root problem. And here you're only having these same problems once a week, and you hardly have any stiffness. I mean, it's like less than 15 minutes, and sometimes it's like a minute or two. Then here in phase 3, this is where people feel good. They feel like they're over the problem already, but the muscle imbalance is still there. You have to make sure that you strengthen the muscles. This requires fatiguing those glutes. And there's other muscles that I'm not talking about here. There's other muscle imbalances, but for the sake of this video, the glutes is the main thing. If you can get the strength up in your glutes and get it to become in the right balance, because usually the hip flexors are way stronger, they're dominant, glutes are weak, but we need this to happen. As they even out, then you become in the right balance, and then your ball and socket joint, it aligns right. It's centered in the socket. The ball gets right in the proper position for the right movement to happen. The hip joint is designed to take pressures. That's what it's built for. But when the alignment's off, that's when you start to get bad adaptations because of the pressures, the bad pressures going through the joint. So once we get the alignment right, then you can strengthen properly, and that's what allows you to move into the fourth phase, which is the maintenance and strengthening phase, because you still have to strengthen a bit more. The biggest mistake people make with hip arthritis is they don't adequately strengthen the glute muscles and other muscles too. They'll focus on strengthening everything, but if you're in an imbalance and you strengthen everything, you're going to increase your strength this way, and then the ball and socket joint still stays pulled forward because your hip flexors are so strong, they're yanking it forward. But if you can do this first, get the glutes stronger, and then in phase 4, we're strengthening everything, that's when you have long-term relief from hip arthritis. That's when you can say, I don't need a hip surgery, and you can feel confident to go walk as long as you want, or you can go hiking, you can go exercise, you can do leg exercises, and you have full confidence that you're not going to flare it up, that you're not going to be in the bed or on the couch, on the recliner for the next 2-3 days or 2 or 3 weeks. That's when you know that you're not slowly marching towards that hip replacement surgery. You know that you're actually going to be fantastic, and it's going to be an afterthought, and you're never going to have to go to the surgeon's office again for your hip problem. Hey, if you've been told you have bone-on-bone hip arthritis, check out this video that's about the root cause that nobody's talking about.